Not since when President Reagan was shot in an assassination attempt nearly 40 years ago has there been this level of concern over a president's health. The White House has not been forthcoming about President Trump's condition. So we're going to turn now to 60 Minutes correspondent and CBS News senior political analyst John Dickerson. He is also the author of The Hardest Job in the World, the American Presidency. John, good morning. So good to see you. Does the White House believe the lack of transparency here is helping them?
Good morning, Jeff. Well, it's not clear exactly what the White House believes. I mean, they are being mildly transparent, so they are letting information out. And in this age where everything is on videotape and where the president is in constant communication with everybody through Twitter, we actually know more than in a lot of previous presidential instances where presidents really hid their medical conditions. You think of Eisenhower's heart attack. They lied to the press about that. Kennedy was sick and lied about it both as a candidate and a president. So this isn't the full transparency on the president's condition, but we do know a fair amount. And at the moment, it looks like we're being relatively kept up to date, although obviously there's issues with transparency in this White House that are broader than just the specifics of this case.
John, what do you think of the video that was sent out of him immediately before he left the White House and went to Walter Reed?
Well, it was striking in the sense, again, you know, this is a president who is in constant communication through his Twitter account. And when he said, "I think I'm doing very well," that tiny little hedge, perceptible only with a microscope, but a tiny hedge from the president, "I think I'm all right," is striking for somebody who is relentlessly and overwhelmingly positive about all instances, even perhaps in cases where, not even perhaps, often and perhaps in cases where it's not warranted. So it was a little sign of how this is different than everything else we've experienced in this presidency.
John, he said, "I think," in the tweet as well, so hedging in a couple different ways. John, when you look at the timeline of events right now, from last Saturday in the Rose Garden through the debate to then what happened, the campaign events on Thursday, what stands out to you the most?
Well, what stands out is that as evidence comes in that it might have been this event at the White House, it's an extraordinary thing that this many months into a pandemic, there is the possibility that there was a spreader event at the White House, the most protected building in the United States, arguably. And it raises, it's not only just extraordinary as a matter of history, but obviously it connects with the central critique of the president, which is that he has not taken the pandemic as seriously as a national matter. And now here, the pandemic comes home, where it wasn't taken seriously enough at the White House. We've seen plenty of events like this. The president has constantly downplayed the need for masks. And now we're seeing the result that all of his public health officials have warned people across the country that if you don't remain vigilant, this is the kind of thing that can happen.
John, the White House says that the president is still fully in control as he's treated in the hospital here, but talk about when or if the 25th Amendment might be invoked. It certainly has been before.
There's certainly plenty of protocols to take care of allowing the president to keep doing his job, unlike Ronald Reagan in 1981, which is a very fast-moving surprise event. He was a very young president at the time. This is slow rolling, and a lot of procedures are in place. For the 25th Amendment to kick in, it would probably, if we even get to that, and we're a long way away from that, it would probably occur in the way that it has with George W. Bush, and even it was sort of used with Ronald Reagan, although he did a kind of a fancy thing to get around it. But and that would essentially be with the president's consent, hand over control to Mike Pence for a period of time, and then it would come back to him.
All right, John, it's been a while. Good to see you. Thank you very much for your time.
Good to see you, Jeff.